It's a real pleasure to be here, and thank you to Scott for inviting me to speak. And one of the exciting things for me as a psychiatrist is we are a relatively small group within CMDA. Unfortunately, we would love to recruit more students into psychiatry. But we have a very strong section. It's one of the oldest sections within CMDA. And we meet every year at the APA, our National American Psychiatric Association meeting, and we have a parallel track during the APA meeting. So if you do decide to go into psychiatry, or if you're interested, I'm happy to talk with you about that. But know that there actually is support within CMDA. We have a strong network, and we actually publish a directory every few years, and I use that when my patients or various friends, family, CMDA members, whoever, call me and say, do you know anybody in Kansas City? Do you know anybody in Denver? And I can use that resource. So we're going to talk today about wholeness, and I like that term better than mental health, because mental health is sort of a silly term in the sense that in the old days, as you know, there's been sort of a distinction, and people like to talk about mental health as if you could somehow distinguish that from physical health. And what I hope all of you already in even first years in medical school are realizing is that any disorder that affects your body has a good chance of affecting your brain. And if your brain develops some sort of a disorder, there's a good chance it's going to affect other parts of your body. And we are not sort of distinct people who have a mental separate from a physical being. We are whole beings. And I think it's really critical to remember that when you are, as a medical student or resident or an attending, or is anybody here married to a medical person? Yes. So you'll see it, and you unfortunately may not be aware that you have entered a very high-risk profession. So does anybody know the rate of major depression, clinical depression, among male physicians? Anybody want to guess the lifetime risk of having at least one episode of a clinical depression if you're a male physician? Anybody else want to guess? We heard a 40%? Okay, so the rate in general for men is about 8 to 10%. For male physicians, it's between 20 and 40%. Okay? For women, the rate in general is about 20 to 25% of women will have at least one episode of clinical or major depression during their lifetime. How about for women physicians? What did you say? 60, beautiful. So probably somewhere between 50 and 70%. Okay? So the rate of suicide among male physicians is about the same as the rate of suicide for men in general in the United States. Which isn't exactly reassuring, but it's, at least it doesn't seem worse. However, for female physicians, our risk of suicide, completed suicide, is 3 times the rate of women in general in the United States. And we think that that may actually be related to our medical knowledge. We are better at completing suicide as physicians than our female non-physician friends and neighbors. So this is not to scare you, but probably nobody told you when you said, I want to go to medical school, that just by entering this profession, your risk of major depression and suicide could be elevated. And I think it's really important that we don't get a false sense of security and think that just because we're Christians, we're somehow going to be immune to that, because we aren't. And I appreciated so much Dr. John Wyatt's talks in the last couple days here, and his sharing about his own experience. He didn't, describe his exact diagnosis, but something that was severe enough to land him, desperate and hopeless on an inpatient psychiatric unit. And I think a lot of us are really scared about that, and maybe even more scared after you do your rotation as a 3rd or 4th year and seeing some people who are clearly very, very ill. But I think what it does do is help us remember that there really are real illnesses that affect people's brains and affect other parts of their bodies, or sometimes illnesses that have affected other parts of their bodies and made them psychiatrically ill, that require care and intervention, and that does not somehow mean that you are a bad Christian or have failed in some measure of your faith if this happens to you. But it does mean you're going to need special care. So what I would like to do is talk in a proactive sense about things that we can do to maintain wholeness, not just in the sense of avoiding psychiatric illness, but in an overall sense of being a healthy, whole person as you go through training. But I want to leave the option open that even if you do everything right, and you have a strong faith, and you pray, and you're part of a community, that doesn't necessarily mean that you are somehow going to avoid a mood disorder, an anxiety disorder, or even a primary psychotic disorder, because many of you are still in the age range where people typically have the onset of major mental illnesses, including bipolar disorder and schizophrenia. And I won't ever forget, I did my residency at Johns Hopkins, and we had a third-year medical student come in to the emergency room one night having his first psychotic break, and he ultimately was diagnosed with schizophrenia, and he was a third-year medical student at Hopkins. So, you know, you're right in the age group, many of you, where many of these illnesses first become apparent. And it's really important to understand that being a Christian does not automatically protect you from that. But there are things that you can do to try to be healthy and whole, and I think they're worth doing and worth facilitating in each other and encouraging each other as part of the body of Christ to help each other in this way. So we talk about the biopsychosocial model. Do they still use this in medical school? And if you're really at a progressive medical school, they might even throw some level of spirituality somewhere in there, or at least give lip service to the possibility that that might be important in some context. But I actually think this is sort of an important idea, that actually to be a whole person, it's not enough to be in great physical shape. You know, it's not enough to have a lot of insight into how your mind works. It's not enough to be a strong Christian. You need to actually have all of those areas of your life working together in concert. And unfortunately, part of medical training, and probably dental and other types of healthcare as well, but certainly medical training, puts barriers into our abilities to maintain health in these areas, right? So what are some barriers that might keep you from maintaining biological, we're going to try to section it out a little bit, biological health during medical school? Time. How would that keep you from staying biologically, physically healthy? Sure. So lack of time can affect your ability to exercise, to shop or cook. Other sleep deprivation, unquestionably. I mean, we know it's a direct risk for things like major depression, but even things like, let's say you're somebody with ADD, and yet you're kind of chronically sleep deprived. Your ADD symptoms are going to get a lot worse if you are not only whatever your baseline ADD is, but also add to that the lack of concentration and focus that comes when you're sleepy. What about psychological barriers that might interfere with your ability to be psychologically healthy during medical school? Go ahead. Pressure of grades, absolutely. So if you're feeling stressed, if you're feeling, maybe you have to maintain a certain grade point, or you're going to be on academic probation or lose a scholarship. What else? Yeah. For many people, it's also things like your concerns about other people. So if you're somebody who is a naturally compassionate, empathic person, and that's one of the reasons why you're going into medical school, and now you know that your roommate is actually really struggling, or your mom at home is sick, those aren't necessarily direct physical problems for you, and yet the weight of that, the concern about that, might have an impact on your ability to function in a healthy way. And then in a social sense, relationships among us, among other students, between students and attendings, between students and the administration can be an additional barrier. If you start a rotation and you have an attending who hates you, who harasses you, who taunts you, that's going to have a cost. It's a potential barrier to you really feeling healthy and whole. And unfortunately, it still happens. And it may be that they're having a bad day or a bad week or a bad month or whatever, and yet if you're the recipient of their difficulties, that's going to have an impact on you. So we identified most of these. I just made a specific list of the barriers that are some of these barriers due to medical training. We talked about the limited time and sleep. I don't know if anybody mentioned finances, but that is a big strain for lots of us. And unfortunately, once you finish medical school, for many of us, that strain does not end. I am still paying off my medical school loans now, and I'm coming up on 20 years next year out of medical school, so I'm almost done. Family strain, whether that's within your own family, if you're married, if you have children, and you're trying to balance that with your medical career. I got married as a second-year medical student. My husband was a fourth-year medical student at a different medical school. He matched, then he moved to Michigan. I was at Michigan, he was at Hopkins. He moved to Michigan for his residency, and so our first, 6 months after we got married, he was an intern and I was a third-year medical student. Try that one on for your first year of medical marriage, and probably some of you have. Frequent rotation changes. Just when you start getting everything figured out, you have to move to a new hospital, or you have to move to a new service, or sometimes you have to move to a new city, right? You have to not only learn the new skill set of going to, cardiology, but maybe you have to learn the new EMR. And all of those frequent changes are very stressful. The isolation is a big issue. And one of the reasons why this isn't to be mean to the men, but one of the reasons why we really are trying to identify the women medical students and attendings and residents at this conference is because I want you to be able to say, if you're struggling, find somebody else with a pink, I took off my name badge. Find somebody else with a pink ribbon on their name badge so you can talk to them. And maybe that leads you to people you meet here on the student council, to relationships that then you can share on. So my very best friends, I met at the Women Medicine Conference 20 years ago. One of them is now a cardiac anesthesiologist in Rochester, one's a sports medicine doc in Minneapolis, but those are the people who over the last 20 years get it. And people in my church don't get it all. People in my psychiatry colleagues don't get it all. People who are, moms of my, kids' friends, they share portions of what I share, but nobody else puts it all together in the way that my women in medicine and dentistry friends do, who are balancing being a doctor and a mom and a Christian. And that's a challenging and unique blend of stressors and blessings. Limited feedback is stressful for a lot of trainees because if you're not hearing back from your attendings how you're doing, and then you get a bad report at the end of the rotation, that's really tough. Supposedly you're now getting evaluated up the wazoo, but at least the attendings think that they're evaluating you all the time. But I'm not sure that you're actually still getting the kind of feedback that you really find helpful. The limited autonomy with increasing responsibility. That is a depressionogenic state, and where we see that at the worst is internship. So what that means, you guys can probably figure this out, you are now being held responsible for things that you may be relatively helpless to control. So as the intern, when they say, well, did you look at the x-ray, and did you get the CAT scan ordered, and did you do this? And you're saying, well, I tried, but nobody wants to hear the but, right? Either you did it or you didn't. And if you didn't do it, it's on you. And the fact that you tried your hardest, but nobody would, talk to you in the MRI suite, or that you, had to battle with the nurses just to get the patient down the hallway, you're going to be held responsible for what is perceived by the team or the attending as your failure, even though you tried your hardest. And unfortunately, that actually continues as an attending, where you may be held responsible for things that you had no control over. Difficult coworkers, attendings, and staff, we talked about, and difficult patients and families. And even at the medical student level, that can be a significant stressor for lots of us. So that can lead to, we're going to just call these partial students and physicians, meaning people who are not whole. That may mean people who are burned out, who essentially are just going through the motions, but they've lost the joy and their calling into medicine, and they've lost the ability to really kind of emotionally and empathically connect with patients and families. It might lead to isolation so that you don't have any relationships, or to being pretty unhealthy in the relationships that you have. And that could be in a marriage, it could be as a parent, it could be with friends or roommates. But there are, as you are well aware, lots of unhealthy relationships among medical people, and you see that lived out. You see physicians treating other people badly, and you see physicians and medical students and nurses and other people being treated badly. And sometimes you will be the one who is being treated badly by nurses or attendings or family members. Materialism and cynicism are easy outs that many people will turn to try to sort of make it through their medical training. I remember one guy at Michigan who was a year ahead of me and was in our CMDA fellowship. And his senior year, he started to kind of look a little brighter. And I was like, oh, you know, this is great. You know, you're almost done. He's like, oh, no. He's like, you know what I did? He's like, I decided to start taking flying lessons. And I was like, really? You know, that's really cool. You know, that sounds great. He's like, yeah. He's like, you know what? It's $5,000. What's another $5,000 at this point, right? Now, that might actually have been a reasonable point. Maybe for him it was more important to actually have a hobby that sort of was fulfilling to him. Maybe that was meaningful. But, you know, this is between him and the Lord. But, you know, that $5,000 that now he's paying interest on for the next 20 years, you know, you decide about the stewardship of that money. Alcohol and other drug abuse. Again, the fact that you are a Christian does in no way protect you from using or abusing alcohol or other drugs. And I bet you have seen this within your chapters and maybe within other places within the university. I cannot get over the marijuana use among students, residents, and adults in my practice. It's honestly a little frightening, and obviously the legalization movement is not helping me, but alcohol and marijuana are depressants, and they contribute to both me having a harder time getting people better from depression or anxiety disorders, and also from people actually addressing areas of their life that need to be paid attention to. They're often used as ways to kind of keep going when you're in a bad relationship or you're stuck at a bad work situation, and they keep people from taking action that should be mobilized by the distress that they're feeling, and it leaves them numb and staying in unhealthy situations. So how do you know if you're whole, okay? I want you to ask these questions about yourself. Are you doing the best you can with what you're made of? Okay, we all have a variety of different gifts and different abilities and different backgrounds and different genetics. So you don't have to compete with, your buddy down the hall who is, running a marathon and going into orthopedic surgery and acing all of his tests and whatever, okay? You don't have to compete with him. You have to be doing the best you can with what you're made of. Now I was sort of fortunate because I figured out relatively early. I was a person who started in the PhD program in neuroscience and then switched over into the MD PhD program. And then once I had some patient exposure, figured out that I liked talking to patients much better than slicing rat brains. So I went on in medical school and finished with my MD and didn't finish my PhD. But it was helpful to me to be able to see, I had these interests, and yet I didn't have this skill set or this passion to be able to continue going on as a PhD researcher, right? Does that mean that I failed because I quit my program? For some people, that's how they felt, that if they left that program, they felt like they had failed. For me, I was able to say, yeah, no, now that I see what I'm really supposed to be doing, I can go in this path. And sometimes making a change, even things like changing a residency, are actually what God might be calling you to do. And yet, that might feel like a failure. And being able to say no or to end something that is a bad path for you, even if it might otherwise be a good path for someone else, takes a level of maturity and wholeness that is sometimes hard for people. Are you building and maintaining healthy relationships? God does not call us to isolation, and now because of technology, we have a better chance of even at a distance trying to build or maintain relationships, but there's really no substitute for people that you can give a hug to, or people that you can go out and run laps with or something. It matters to have healthy relationships. And that also means being able to identify and either avoid or exit or escape a toxic relationship. And there is no protection just because you're a Christian. That does not mean you might not find yourself in an abusive relationship. It doesn't mean that you might not find yourself in a friendship with someone that you didn't realize was sort of psychologically unhealthy and then turns out to have borderline personality disorder. But if you find yourself in a relationship with somebody who is abusive or toxic in some way, then finding out how to either set very clear limits and boundaries in that relationship or to remove yourself from that relationship is going to take work and may be difficult and may contribute to more stress and less wholeness. Managing your stress and your emotions in healthy ways. We talked about not using alcohol and other drugs to do this, but it also means being able to seek help. So this is not a skill set that necessarily everybody comes into medical school with. And if you're somebody who it's not until medical school that you finally figure out kind of you reach your limit, maybe up until now you were able to study, you were able to do well, you were able to have good relationships, and now this is the point at which you've kind of maxed out and hit the wall. You may need help to figure out how to get through there. It doesn't necessarily mean you can't be a doctor or can't graduate, but you might need help from peers, from a pastor, from a counselor, or even from a psychiatrist. And we're not that scary. Some of us, at least, are not that scary. But it's better to seek help on your own steam than, you know, when I get the call from the dean, this person's about to be thrown out of the medical school, could you please see her? Okay? Realistic expectations for career and family roles is a big deal, and that could be a whole nother talk. But that ability to, as you're in real time, figuring out what your career calling might be and how that dovetails with either developing possibly a marriage and family or the disappointment or heartbreak if that is lost or you never find that person that you're desperately hoping for. Either of those can obviously be major stressors. And then a whole person is beginning to identify and pursue his or her goals. And that's what's exciting about what we do. The other barriers, and I'm not going to go through all of these, that are significant for Christians is our spiritual barriers if we have not either started to confront some of these issues as medical students and residents. If you yourself don't have a personal system of your beliefs or faith, if you have had bad past experiences with the church or another faith community, people come sometimes out of had very painful experiences, let's say with a college, I don't know, InterVarsity chapter or something like that, that turned them off to Christian groups. Rigid faith communities that are unable to tolerate doubts. If you're part of a church that says, you just need to believe, you just need to have faith, and yet you start wrestling with, but why does God let innocent babies suffer? And what does happen to the 2-year-old who dies? Do they go to heaven or do they go to hell? If you don't have a safe place to ask those kinds of questions, hopefully your CMDA group can do that, but not everybody has that. If you yourself are uncertain about death or the afterlife, if you're not able to tolerate death or suffering, most of us haven't really had firsthand exposure to that until we get to medical school. And that first time that you're the one with a dying patient, as a third-year medical student or as an intern, the first time that you maybe have to declare somebody dead. The dark night of the soul. Christians throughout the ages have had struggles with their own faith in the context of their own suffering or other people's suffering. And that's a point at which sometimes people sort of romanticize that within the church or spiritualize it in the church. It may indeed be a spiritual struggle. It may also be that you're going through a clinical depression. And so having someone who can help you sort that out, and if it's a clinical depression, get you the help that you need, or if it's not, or you are also having a spiritual battle, to be able to get you that kind of help as well. It's not always simple. And just because you can't figure it out, don't assume that you're stupid. It may be that it really is hard to sort out, okay? And of course, if you have no time or energy to develop to finding a church, getting to church, going to your CMDA meetings. So in Philippians, Paul said, I've learned to be content whatever the circumstances. I know what it is to be in need and what it is to have plenty. I've learned the sense of being content in any and every situation, whether well-fed or hungry, whether living in plenty or in want. I can do everything through him who gives me strength. Which sounds great, right? And we use these verses to try to help buoy us up in difficult times. And that's not a bad use of these verses. But the problem is, when you feel like you are failing in that, then the risk is that you will end up, again, sort of feeling personally defective or as if you have failed, instead of considering the possibility that you may be under stressors beyond your control, or you may have developed something like major depression or an anxiety disorder that may need help. So you need to stay whole, know your family history, especially your risk of major depression. If you have a parent who's had depression, your risk is going to be a little bit higher. If you are a woman, your risk is going to be higher. If you have a baby, your risk is going to be higher. If you have certain physical illnesses like diabetes or rheumatoid arthritis, your risk is going to be higher, okay? If you do have any type of physical or mental illness, doctors make terrible patients, medical students aren't much better, and we tend to just kind of keep working and not actually attend to those things, and then we get surprised when we have trouble, and then we blame ourselves for not being able to work through it. And instead, what you want is to get help early so that you can actually recover and sort of get back to work, as opposed to keep working and then fall apart and have to stop. Do your best to try to maintain your sleep and your nutrition and exercise and limit alcohol and caffeine. Learn how you manage stress management best. If you are an extrovert, you may really need other people to help manage your stress. You might do better, organizing a running group and, going out and running whenever you're not on call. If you're an introvert, you may need to make sure that if you have to be around people all day at the hospital, that you have a quiet, calm place where you can recuperate by yourself at home. And if you're living in a house with 7 other people, that may be a bad environment for you. You may need a different way to recover. So you have to know your own personality traits and strengths and vulnerabilities, and what your interests and passions are, so that you can shape how you use your time. You will not be able to do everything, and you will not be able to do everything at the same time. So one of the things I do now that I love is I host I host a monthly group for women in medicine. It's a WIMD group at my house once a month. I wanted to do that 10 years before I was able to do that. But first I was finishing residency, then I had 2 little kids, and there was just no way I could do that. It wasn't that I wasn't called to do it, it was that I couldn't physically do it. I was starting my practice. Once I moved to Cleveland and had time and some other resources and my kids were older, then I was actually able to mobilize that passion. So don't panic if you can't do it all early or immediately. It's okay to wait on some of those passions and hopes until you actually have time to do them. And that has a lot to do with this one, learning to say no. And it's hard for many of us because we actually get stuff done, which means people will ask you to do things. And the challenge is for you to actually discern, yes, this is something I'm interested in. Yes, I'm capable of doing it, but does God want me to do that right now? Is this something that only I can do and that I'm called to do, or is this something that somebody else could do? Or I'm not called to do it right now. Socially, we talked about limiting contact with toxic people. I think this one, coordinating your self-care with social time. So hopefully a lot of you have figured that part out. Eating together with other people. When I had my son right after I finished my internship and took a year off and then did my PGY 2, 3, 4 years at Hopkins while he was, ages 1, 2, and 3. And my husband would bring him in if I was on call, and I might only see him for like 10 minutes. But my office, I had a little blue candy box with a lid that he knew was there. So his association with going to visit mommy at work was candy. And I was coordinating my little 10 minutes of, toddler time with my work when I had limited availability to get home. And that's, I guess, also including loved ones in the medical world. What I would not do, speaking from personal experience, is if you happen to have your husband be on call for your first wedding anniversary, do not attempt to spend your first wedding anniversary night in the call room with your husband. I'm just going to tell you, don't do it. Try to minimize your frequency of changes. If you can, have sequential months in the same place if you have control over it. And virtual contact is better than no contact. So if you can Skype or FaceTime or something a friend, if you're off somewhere else, That's better than nothing. Spiritually, you do need to join and stick with the supportive faith community. A CMDA chapter is good, but it's not the same thing as a local church. And I would really strongly encourage you, even if you can't go often, even if they don't seem to know who you are, even if they forget whether you're a student or a resident, or they don't even understand what a student or a resident is, then don't give up, okay? Keep trying, and if you keep trying over a period, hopefully 1 or 2 people at that church, if you can try to get adopted by a family, connect to another doctor in the church, somebody who knows who you are, knows if you show up or not, and can maintain contact with you. I think this one is really important. It's okay to be angry at God. Don't be afraid of pouring out your soul. You know, read Psalms if you need to, but if stuff is unfair, if you are being unfairly treated, don't pretend. Like, be honest about it. And if you have a safe person that you can share that with, share that. You don't have to hold it all in. The listening for patient spiritual concerns is a real gift. And you are going to be offering something to patients that other people will not do. And even as a medical student, especially as a third-year medical student, you might be taking longer histories, doing more detailed physicals than anybody else is. You may have some unique opportunities to be able to identify and respond to patient spiritual concerns. Don't underestimate that ability. Finally, this verse from Psalm 73 reminds me, "My flesh and my heart may fail, but God is the strength of my heart and my portion forever." And what that reminds me of is, whatever you do, remember that this is temporary. Medical school is temporary, residency is temporary, being attending is temporary, working is temporary, life is temporary. And I appreciated so much when Dr. Wyatt was sharing about his breakdown and his hospitalization, that he never thought, when he was in the midst of it, that he would be able to continue his medical work or his spiritual ministry, and yet here he is. And if you ever find yourself in a situation where you are in the midst of a depression or an anxiety episode or some other kind of crisis like that, don't assume that will knock you off the track forever. The goal is to take the time that you need, get the help that you need to recover, and then go to the next step. And whether that's continuing in medicine or not is not the important thing. The important thing is to remember that that's a temporary phase and does not mean that you have failed in some way. Okay?